Good afternoon, everyone. Thank you for joining our webinar today. This is the Ending the Epidemic, a Local Public Health Policy webinar brought to you by UCHAPS. Today's speakers, we have Kimberleigh Joy Smith and Adrian Guzman. We'll learn a lot about them today and the work that they do. And first, I just wanted to share with you some of our upcoming events that will be brought to you by UCHAPS. Following the webinar today, we will have the after party that will be hosted by myself with special guest Anthony E. Fox. Anthony E. Fox is the current Division Chief over the HIV/AIDS, Hepatitis, STD, and Tuberculosis Administration, otherwise known as HOSTA, at the DC Department of Health. He will be with us today on Facebook Live following the webinar at 3 p.m. to 3:30 p.m. right after the webinar, so stay tuned after this session is over. Now, the goals of our webinar today, we hope that you will be able to create a positive, supportive relationship between community-based organizations and local health departments, be effective partners for community, and strive to improve overall health and well-being of citizens, including mission focused on HIV prevention, and improve partnership capacity building to break down traditional barriers to collaboration. So without further ado, I would like to begin our webinar by, again, introducing our speakers today. First, we have Kimberleigh Joy Smith. And I'll tell you a little bit about Kimberleigh. She is the current Senior Director of Community Health Planning and Policy at the Callan-Lore Community Health Center in New York City. She is involved in New York's ending the epidemic activism since almost the beginning. Served on the Governor Cuomo's ending the epidemic task force in her capacity with Harlem United. Served on Women's ETE Advisory Group. Ongoing involvement within AIDS New York 2020 Legislative Committee and New York City and State. She also has worked in New York's HIV and LGBTQ communities for nearly 25 years, and she emphasizes, yikes. Next is Adrian Guzman, who is currently the Director of Policy and External Affairs for the New York City's Health Department Bureau of HIV/AIDS Prevention and Control. Adrian joined the Health Department immediately after the release of the NYS Ending the Epidemic Blueprint. Prior to that, he focused on HIV criminalization and access to sexual health care for youth in the state custody settings at the Center for HIV Law and Policy, and prior to that, on legal services for people with HIV. So without further ado, I am going to hand it over to our speakers today. And I'm going to give Kimberleigh the controls.
Great. Can you hear me?
Yes, we can.
All right. Oops. I'm going to try to advance the slides here. For some reason, mine aren't advancing. Are they advancing on that end?
Kimberleigh, I'll give it a try. One sec. Sorry about that.
It's okay. Okay. Well, first off, thank you so much to UCHAPS and Martinez and Tony for inviting me and Adrian. And thank you all for being here in New York City. It's a very hot, beautiful day. So I hope that you all are having a great day yourselves. We are going to talk a little bit about the ending the epidemic story here in New York State and city. We're going to start with the state level, since that's really where it all started a couple years ago, and talk a little bit about the blueprint. We're going to move into talking about New York City's ending the epidemic plan, and then really get to the heart of the matter, which is so far our success, which has really relied heavily on community collaboration and implementation, and then provide a few case studies, if you will, regarding the ETE efforts. One about the sexual health clinics, one about PrEP for adolescents, and finally about safe injection facilities. And then we'll end with some next steps and hopefully get a good question and answer period and discussion going. So, oops, I'm not doing that. Is there somebody controlling the slides?
Kimberly, I've just advanced the slides to the next section.
Okay, great. All right, so like I said, UCHAPS has asked us to sort of give you the story about the ending the epidemic efforts in New York. And really that story is a story of government and community in action. It started really with, I hope this is the case for other ending the epidemic efforts, not just in New York, but other places and jurisdictions around the country. But it really starts with the science. And if you think about the progress that we've made in many areas of the HIV epidemic, whether it's mother-to-child transmission or even the reduction of HIV transmission via injection drug use, or some of the more recent developments regarding U equals U, or undetectable equals untransmittable, knowing that if you are undetectable or living with an undetectable viral load, that it's not possible for you to pass along the HIV virus to another person. But it's with that science, and when you add the sort of the community's activism and I think it would be fair to say impatience with regards to, even with that progress, that we weren't quite getting to where we needed to be with the HIV epidemic. And then add in that political will and some funding, and what you result in is the ending of the epidemic, or at least that's what we hope we will result in. So in New York, we really started these efforts at the New York State level, but it didn't just happen overnight, for sure. That's Governor Cuomo you see on the right there, our current governor, Andrew Cuomo, who was the one who, made this pronouncement that we should get to an end of the HIV epidemic as we know it here in New York State by 2020. So can I advance? No, good. But like I said, that he didn't wake up one morning and just think to himself that this could happen. And it was really the push of the community. And it started, there was also I think a really a political gestalt and timing issue that we took advantage of, which was that it was after he passed marriage equality here in New York, and he was in between elections, and the community saw an opportunity to try to get this to happen. And so in May 2013, we delivered a letter to Governor Cuomo calling for an organized response to the epidemic in New York. And then that fall, the folks from Treatment Action Group and Housing Works and other groups put together 6 community-led meetings across the state to discuss making this a reality. And those meetings included, epidemiologists and providers and community members. And so the meetings were really well informed. And then it wasn't until June of 2014 when Governor Cuomo announced his 3-point plan to end the epidemic by 2020. And that 3-point plan here in New York includes identifying all persons with HIV who remain undiagnosed and linking them to care, and linking and retaining people with HIV in care to maximize viral suppression, and providing access to PrEP. And so this was really revolutionary at the time. He made an announcement, I think it was on the Sunday of Gay Pride in June of 2014. And then it was in 2004, later that year, in October, that he convened this large task force to develop what we now know as the Ending the Epidemic Blueprint. In 2015, later in 2015, well, actually pretty early in 2015, around April, he released the blueprint because the task force met over a number of months, actually not that many, and we did an incredible amount of work. As was mentioned earlier, I sat on the task force in my prior role with Harlem United. It was an insane amount of work in a short amount of time, but we did come up with this blueprint, and it set forth 30 recommendations that were obviously aligned with the 3-point plan. There were different subcommittees that organized into groups. And then, but it further added that, these what we call these getting to zero recommendations. And these were somewhat more controversial recommendations that, we felt like could really accelerate the end of the epidemic if they were deployed. And they addressed more social, legislative, and structural barriers to ending the epidemic. And it was really about sort of getting the number of new infections to zero. One of the original metrics for the Ending the Epidemic plan was to move the epidemic to a point where new infections were below 750 each year. And so these 7 additional recommendations were really about getting to zero new infections per year. And then in September of 2015, the Ending the Epidemic dashboard was created and launched. And this was created by, I believe, CUNY School, and it's a public-facing website. So it broadly sort of highlights and elevates the metrics and the information and the progress that we are making towards the Ending the Epidemic goal.
Great. You can hear me, right?
Yep.
Can you hear me?
I can.
Oh, great. An audience of one, perhaps.
Yeah.
Thanks so much, Kimberly. This is Adrian Guzman, and to continue the story Kimberly has started, in December 2015, to coincide with World AIDS Day, the New York City mayor and city council speaker announced the New York City Ending the Epidemic plan, which included a $23 million investment to support the initiative. So we sort of see New York City's take on ending the epidemic as a New York City specific set of strategies. So on the next slide, I'll outline the 5 strategies that we consider a sort of more practicable version of the ETE blueprint, taking into account the local epidemic and the health and healthcare needs of New York City residents affected by HIV. So we have 5 strategies. First, transform the New York City Health Department's STD clinics into sexual health hubs, and we've reinvented them as sexual health clinics. Second, to launch a PrEP delivery system and repair our PEP delivery system. Third, to support priority populations such as LGBTQ New Yorkers, individuals who use drugs, using novel strategies. Fourth, take the New York City viral suppression rates from good to excellent. And fifth, to make New York City status neutral so that we treat New Yorkers like individuals and not as HIV statuses, to really ensure that we're creating an environment to accompany all of our other efforts, to create an environment that is status neutral and encourages the ending of stigma and discrimination related to HIV.
Great. So to continue on with kind of the theme of the story, we're now, we're not at 2020 yet. We're obviously still in 2018, so we're about halfway there. And I think one of the things that's making our efforts here in New York State and New York City so successful thus far is that we have combined the community with collaboration and really aggressive implementation. And so that's really the algorithm, if you will, or equation that's yielding our success so far, both in process and in outcomes. But again, we have a little ways to go, so the true test will be if we can achieve our goals by 2020. But we think that, since the beginning of the organized ETE efforts, that, policy efforts plus budget investments, really driven by the community and government, have linked more New Yorkers to HIV prevention and care services, thus reducing the number of new infections and improving the health of people living with HIV. And we were very proud and remain proud this year to note that the number of people newly diagnosed with HIV has fallen to historic lows both in the state and the city, dropping 9% from in between 2015 and 2016. So we are definitely on track and need to kind of keep our eyes on the prize.
And Kimberly, I wanted to mention that a couple of months ago, we sort of hit the halfway point of the whole ETE process. And it was an excellent opportunity to look back at what we've accomplished and to look forward to what we still have to accomplish, and to identify services and programming and policy initiatives that can help us achieve our goal of ending the epidemic by 2020, now that we're at about that halfway point. And the state health department set forth some really excellent guidance on how we can strengthen our efforts moving forward.
Exactly. Yes. And so, but when I talk about community and collaboration, people may think of different things. And we're going to kind of go through some of the examples of what I mean by that. And so, really, I think one of the ingredients to the success we've experienced here so far in the state and the city is that we've used, some formal mechanisms that were existing already, to kind of leverage the ETE plan. And so some of those mechanisms are listed here. The New York City Planning Group, which this is, as you know, formerly it was known as the PPG, the Prevention Planning Group. It helps update and inform the CDC on jurisdictional HIV prevention planning. And then we have our Planning Council, which, as you know, allocates funding and helps to determine spending priorities related to Ryan White Part A funds. And then a newer advisory body that's specific to New York City is the Women's Advisory Board. This was just formed in January of 2017 to address issues related to HIV and women's health, specifically for New York City. And it is sort of off and running and has already greatly informed a new social marketing campaign that's up and running here in New York City called Living Sure, reaching women to create awareness about PrEP and women. So those are a few of our sort of more formal advisory bodies. Next slide, we'll move on to a couple of other advisory bodies, and one is the AIDS Advisory Council's ETE subcommittee. Now, the AIDS Advisory Council, like those other bodies, except for the Women's Advisory Body, existed before the ETE efforts, and it was formed in 1983 with the AIDS Institute here in New York State, which is part of our Department of Health. And that AIDS Institute and the AIDS Advisory Council is supposed to advise our state commissioner of health to come up with a response to the HIV and AIDS epidemic. So clearly, when the blueprint was released and the community was sort of energized around the ending the epidemic plan, we knew that we wanted to not bypass existing infrastructure, but rather use the existing infrastructure. And so the AIDS Advisory Council set up a specific ETE subcommittee to really sort of make sure that implementation plans were being developed and happening, and also to sort of help inform funding. And then one of the coalition that's near and dear to my heart, which is the End AIDS New York 2020 Coalition. This is completely community driven, and this includes more than 60 organizations which comprise the Ending the Epidemic effort in New York State. And every other week on Thursday mornings, we have legislative calls. These are facilitated by our colleague Reed Vreeland at Housing Works, but a variety of people show up on the calls, and that's really how the ending the epidemic legislative priorities and budget priorities are developed and pushed, and it's really where the activism and the advocacy continues to happen outside of the formal sort of pre-existing structures that I talked about earlier. Next slide. And so this is a little bit, that's just a graphic to show you, you know, kind of what community looks like. If you look at the slide on the left, you can see way at the top in the middle, there I am. This is from a rally in Albany, New York, which is our state capital, from January. And the right-hand side, I believe, is in front of City Hall. But this really sort of illustrates that, you know, the ingredients to a successful ETE effort, at least here in New York, have really relied on the community's mobilization, the community's impatience and activism, and collaboration and shared leadership with government to make it all happen. So here, just a few examples of our policy successes that Adrian and I will kind of go through together quickly. On the far left, we have the HASA for All expanded eligibility, which in New York City, this happened, I think, in the summer of 2016. HASA is a city agency. It stands for HIV/AIDS Services Administration. And so we were able to broaden the eligibility for HASA to be to include folks who are HIV positive and not AIDS diagnosed. Previously, it was AIDS diagnosed, and you had to virtually be, you know, have an AIDS diagnosis to have access to the benefits that HASA provided. Most and importantly, housing, but other social support services as well. And so we were able to broaden that eligibility to include HIV positive folks, thereby allowing more people access to housing, which we know is a very important driver of health outcomes. And we were also able to make it possible so that people living with AIDS did not have to pay more than 30% of their subsidized rental income towards rent, which was very important. That was one couple policy developments that happened in 2014. And then as well in 2014, we expanded HIV data sharing between health departments and healthcare providers. So making it possible that healthcare providers could access that data and then, you know, provide more aggressive linkage and retention and care for people living with HIV and improve health outcomes.
And then on the third pillar, we wanted to highlight our 2014 policy change that eliminated the requirement for written consent for HIV testing in all settings but the correctional settings. And the following year, in 2015, the policy change extended to correctional settings. And this policy change follows years of advocacy and research really showing that the requirement to get consent in writing, separate written consent in writing for an HIV test did serve as a barrier to increasing the number of people getting tested. On the fourth column, it is our condom as evidence item. For years preceding this policy change, we had received reports that the New York City Police Department, in some cases, had used the possession of condoms as a way to establish probable cause for arrest for certain prostitution-related offenses. So, you know, on the one hand, you have the New York City Health Department distributing millions and millions of condoms a year, and our sister agency, the NYPD, using them to assist in the criminalization of individuals. So after a number of again, collaborations with community partners, we moved forward a policy change that prohibited that use of having condoms on your person as a means to establish probable cause for arrest or prosecution for certain low-level prostitution-related offenses.
Right. And I wanted to just note that most of these, or all of these actually were legislative or policy recommendations that were embedded in the blueprint itself. So these did not, you know, the community kind of came up with these recommendations as these policy changes as recommendations, and then we moved on them once the blueprint was sort of adopted and released. Some of them were included in the Getting to Zero thing that I talked about. Some of them were sort of incorporated in the regular recommendations. But in 2015, we were able to explicitly decriminalize syringe possession, or even having a residual amount of a controlled substance on a needle, I guess, for persons participating in our, what we call the Expanded Syringe Access Program. And it also, this policy change that happened in 2015 also clarified that selling syringes, if you were with an ESAP program, an Expanded Syringe Access Program, that you were able to sell syringes, or if you were a medical provider, you were able to sell syringes. And so there had, prior to this, been some conflicting laws in terms of public health and criminal laws, and so we were able to kind of smooth those out in 2015. We are still, unfortunately, not able to, pharmacies can't advertise that they can sell syringes, but we are sort of moving in that direction.
And as Kimberly mentioned, the blueprint doesn't just serve as a blueprint for programming and services. Exactly as she mentioned, it really serves as a blueprint for legislative and regulatory activity. And in addition to what we've just mentioned, the first major set of what's often called the Ending the Epidemic legislation occurred in 2016. Over the summer, the New York State Senate and Assembly passed a set of bills around HIV. And to coincide with World AIDS Day in 2016, the governor signed them into law. And the four provisions include further streamlining HIV testing. What we did was we removed informed consent from the process, so that all that's required now is for the provider to mention that an HIV test is to be performed, and then allow the patient to opt out if they wish. This brings us closer than ever to the CDC recommended model of opt-out testing. We also removed the upper age limit for offering an HIV test, so that anyone over the age of 13 must be offered an HIV test in certain settings, inpatient care, hospital care, in an emergency department, and also outpatient services. Prior to this, we had required the offer of an HIV test only for individuals ages 13 to 64. Third, we expanded access to STI testing so that we allow a provider to issue a non-patient specific standing order, so that nurses can screen individuals at high risk for gonorrhea, chlamydia, and syphilis. And fourth, we expanded access to PEP in pharmacies, so that pharmacists can dispense PEP starter packs up to 7 days of PEP pursuant to a non-patient specific order. So a couple months following that, the New York State Health Department launched a pilot program so we can roll out the PEP in pharmacies provision thoughtfully and strategically across the state. And a number of pharmacists and pharmacy settings are participating in the pilot and receiving technical assistance and best practices on how to work with a customer who may come into the pharmacy seeking PEP for having been exposed to HIV. So following those four bills that were signed into law, we had two major regulatory changes that occurred last year. First, through regulatory amendments to our state sanitary code, we have, for the first time in the history of the HIV epidemic in New York State, characterized HIV as one of the delineated STDs through our state sanitary code. And what this has the effect of is it now allows minors to consent to HIV prophylaxis and treatment without parental guardian involvement. So prior to this regulatory amendment, young people in New York State could only consent on their own to HIV testing. They could not do so without their parents or guardians' involvement when it comes to HIV treatment or HIV prevention, such as PEP and PrEP. PEP was a little different because it counts as an emergency situation, so it was mostly PrEP that was, there was still that barrier. So by making HIV an STD, we've opened up these opportunities for young people. And second, also through regulatory amendment, we expanded our HIV data sharing capabilities so that health departments can share HIV-related information with care coordinators for the purpose of linkage to and retention and care. So as Kimberly mentioned a few years ago, we did the same for the healthcare provider for the HIV position, but we know that care coordinators are uniquely positioned to work on finding individuals who are out of care and encouraging them to link to and retain care. So we wanted to make sure that they had access to the information necessary to do that as well. And that's where we are currently as we move forward.
Right. So it's been very exciting because there's been a lot of activity, obviously a lot of the policy activity that we just spoke about, but also significant budget investments both on the city and state level, which we don't have an explicit slide about, but suffice it to say that our mayor here in New York City and our governor and legislature has for the most part stepped up. We do need them to kind of keep it up. But this has yielded some impressive results. And so one of the metrics, I spoke about the number of new infections earlier, but one of the other metrics that we wanted to measure the success of the ending the epidemic effort by was new HIV diagnosis. And the number that is the target for 2016, we've actually exceeded. So you can see on this slide that the target was 2,911 HIV diagnosis, and the actual is 2,881. And I guess just to clarify that new diagnoses represent the number of newly diagnosed cases in HIV, regardless of when the HIV transmission actually occurred. We know that sometimes, historically, new diagnoses have typically tracked new HIV infections on a 5-year lag, which is why I think the state wanted to focus more on new diagnosis rather than so much focus on new infections. But you can see that we by this metric there is success. Now there are plenty of other metrics in terms of viral suppression and mortality, which the state and city are very closely tracking, and I think we are making good progress. But this was one of the most exciting, promising results that we saw in the last year for which we have data.
So we wanted to offer 3 case studies that illustrate the government-community partnerships that have resulted in some real changes here in New York City and really across New York State. The first one is the enhancement and transformation of our New York City sexual health clinic. So back in March 2015, which was after the state ETE blueprint was released, but before the New York City ETE plan was released, the health department announced that one of our 8 STD clinics would close for a good amount of time while we extensively renovated the clinic. The Chelsea STD clinic was our largest clinic, saw the most number of patients, and there was significant community objection to this and frustration. Well, I think everyone understood the need to ensure that our clinics were up to snuff and the facilities were in good condition. There was a good amount of outcry on what a lot of people saw as inadequate plans to serve the patient population that the Chelsea STD clinic served. So on the next, actually you can see on the top left is a photo of our Chelsea clinic, and on the bottom left you can see some demonstrations by ACT UP and other advocates who were really pushing back on the city for closing the STD clinic and not having what they considered an adequate substitution or alternative for patients that the Chelsea STD clinic serves. And if you, as many of you know, while we've seen decreases in new HIV diagnoses, we haven't seen similar decreases in new STI cases. And the clinic closing came just as, we were seeing a good amount of new STI cases as well. So on the next slide, I just wanted to mention why our New York City sexual health clinics are so important. Here in New York City, 10% of new HIV in New York City is diagnosed in our clinics. 20% of our acute HIV diagnoses occur there. And our sexual health clinics, they really serve as a safety net for many people with HIV who are not otherwise connected to care. And they are existing models of immediate antiretroviral therapy start for new diagnosed individuals. They're particularly ideal settings for this sort of immediate connection to care. They also provide for us a really solid, robust data set based on all of the 8 clinics and the patients that each sees. And this really supports our treatment as prevention idea. And, at the end of the day, STD clinics have a proven track record for connecting patients to care. And you can see on the right-hand side where our clinics are located, and the majority of them are located in areas most affected by HIV. So then on the next slide, I'm very happy to show that in March 2018, about 3 years after the clinic closed, on the next slide, you can see a photo of the reopening. And what we did was, a couple months after the Chelsea clinic closed, the mayor and our city council speaker made the announcement about the $23 million investment in the New York City plan to end the epidemic. And based on community feedback, based on conversations and town halls that we had, sort of get an idea of what the community was thinking, we knew that it was really important to invest a significant amount of the New York City ending the epidemic funding into our STI clinic infrastructure. So what we did was reinvent our STD clinics as sexual health clinics. And these really truly serve as sexual health hubs and not as STI and HIV diagnosis and treatment centers. So as of July of 2018, at our clinics across the city, all patients aged 12 years and older can receive STI testing and treatment, as well as HIV testing. And eligible patients can receive HIV treatment initiation, PEP, and PrEP initiation, all sorts of vaccines for HPV, meningitis, hepatitis A and B, emergency contraception, counseling, including screening, brief intervention, and referral to treatment for alcohol and drug use. And also, importantly, benefits navigation. We understand that many patients who visit our sexual health clinics might not have access to healthcare coverage and other social support safety nets. And we wanted to make sure that we can direct them there. And none of this would have happened without all of the community advocacy that really helped us identify the importance of supporting our STI prevention, care, and treatment infrastructure here in New York City. And I should also mention that all of the services now, in large part thanks to our New York City ending the epidemic plan and funding, all come at low or no cost to individuals who visit, regardless of immigration status and regardless of under insurance or uninsurance.
Great. And so the second case study refers to a policy change that we talked about earlier related to granting access to preventive and HIV treatments for young people. And so this is really exciting, and particularly exciting for me personally. I was involved in this, and I am a parent of a 15-year-old, so I know how important it is to provide sexual health screening and treatment and services for young people. But this, originally, the PrEP for Adolescents was written up in the blueprint as a getting to zero recommendation. As you recall, one of the more controversial recommendations at the end of the document. And I'm not going to read the full thing, but you can see the recommendation listed here below. But the idea was really to guarantee minors the right to consent to HIV and STI treatment, diagnosis, and prevention, and prophylaxis, including sexual health-related immunization. And this is something in New York State that young people without parental support or consent were already able to consent to STI treatment and screening, but not HIV. So we worked really hard to make this a reality. Next slide. In addition, the New York State Department of Health bought in pretty early and convened a forum really looking at, the pros and the cons and the implications of providing this access specifically to PrEP for young people. But we realized pretty soon, I think the community realized, along with the State Department of Health, that this is not going to be able to happen in a legislative way. We were not going to be able to make a law, that was passed by both houses of our legislature and then signed by the governor that granted access to young people to HIV treatment and prophylaxis. Our Senate here in New York State is still, although right now numerically Democrat controlled, but it's just conservative, and we just knew that was not going to fly. So the regulatory changes that Adrian talked about earlier were sort of the roundabout way, but very effective way that we were able to get this done in close consultation with our partners in government, both state and city. So you see on the next slide that in December of 2016, we were able to recommend that the Department of Health propose an amendment to our sanitary code to add HIV as a group B STD. So essentially, adding HIV as an STI would enable young people to take advantage of the screening and treatment the same for HIV, the same way they would for other STDs or STIs. And so there was a public comment period, and we organized to make sure people were commenting in the affirmative. Obviously, there was some opposition. I think from what I understand, there was some opposition from some religious groups and others, but we were able to get past that, and the regulatory change was finalized in the spring of last year. So now, our local health departments, including the one where Adrian works, must provide HIV diagnosis and treatment, including prevention services, PEP and PrEP, either directly or by referral to minors. And they, we're working on making sure that the explanation of benefits and billing records, cannot be released to a minor's parent or guardian without the minor's consent. So all of this is really great news. And when you think about the burden of the epidemic on many young people, particularly young gay men, young transgender folks, and young folks of color, this is a pretty big win for us. Although largely sort of...
Oh, go ahead.
I was just going to add, largely kind of not super talked about. There was some press when it first happened, and that part of that was deliberate to kind of not make it, a big splash. But I think it's one of the biggest things that's happened through the Ending the Epidemic effort, but not necessarily one of the things that's most well known.
Yeah, I was just going to echo that. Like Kimberly, I'm most excited about this policy change over the last couple of years, and I'm very proud to say that when Kimberly mentioned the public comment period, I wanted to mention that the New York City Health Department was among those who submitted comments. It's not particularly common, or I guess historically, it's not been common for the New York City Health Department to weigh in on policy changes, not only at the state level, but also at the federal level. And I have to sort of give props to Commissioner Mary Bassett, who is our health commissioner, who under her leadership, the health department really has, in my eyes, become a sort of activist organization. And we were very, very supportive of the proposed regulatory amendment that Kimberleigh and the End AIDS New York 2020 team had really had a hand in developing. And we worked closely with the state to make sure things were moving along nicely, and that guidance that followed the regulatory change would come out soon. So this was another example of how we took a lot of cues from community advocates and activists to make sure that the state health department was hearing what our community partners were saying here in New York City.
Right. Yeah. Yeah, and I think just to emphasize the point of, I've been talking a lot about our elected officials and our partnership with elected decision makers, but obviously this presentation hopefully should elevate the importance of our agency officials, such as the Commissioner of Health at New York City, Mary Bassett, and our AIDS Institute head here in New York State have been really instrumental. And had they not bought in early, we would not be where we are, you know, in terms of the progress we're making with ending the epidemic. So the next slide, really, we're going to talk about one final case study very briefly, which is the case study of safe injection facilities. Safe injection facilities are facilities where they exist in other parts of the world, actually, but they are facilities they are medically supervised and allow people to inject drugs safely and with medical supervision. And so this has been, you know, in recognition of the ongoing issues of drug use, opioid overdose issues. This is has been part of the ending the epidemic, and obviously the connection between drug use and HIV is very concrete. And so we in New York City have really been pushing to make it possible, and in this state have really been pushing to make it possible to open up safe injection facilities here in the city and in the state. And so in 2016, the community and advocacy and public health officials were able to convince our New York City Council to allocate $100,000 to study the feasibility of establishing a SIF here in New York City. And it took a long time. They did that. They did the study, but it took a very long time for the mayor to release the report. But finally, just this past couple of months, in May of 2018, the mayor, our mayor, Bill de Blasio, released a report, which you see pictured here, and it addressed these questions. Would New Yorkers support SIFs? What are the potential health and fiscal benefits to having a SIF in New York City? And what are the viable legal frameworks within which New York City could establish a SIF? So we were very excited when he finally released a report. It took a lot of activism, not only to get the council to allocate the funding, but then to get the mayor to release the report once it was done. The activism lasted right up until the mayor actually did release it, and it included folks, you know, taking over City Hall and being dragged out, and all kinds of rallies and several calls to action in the media, but we were finally able to get this report out. And so it found that the next slide shows that the findings were favorable, that, you know, supervised injection is indeed, which we knew, an evidence-based intervention for people who inject drugs, and that leaders do recognize the benefits of establishing supervised injection as a strategy to prevent overdose and reduce crime. And in fact, we have support in New York City from a couple of district attorneys, and even our New York Police Department has sort of softened its stance on supervised injection facilities. And then the mayor found that, actually the report found that if we were able to establish these supervised injection facilities, we could avert up to 130 overdoses and save up to $7 million in public health care costs annually. And then finally, that the establishment of supervised injection facilities in New York City is legally possible. We do know that it's happening in other cities and jurisdictions. They operate in Vancouver, in Canada, and other places across the world, and so that it is possible. And so the report recommended that we do in fact come up with these 4 pilot CIFs, or overdose prevention centers. They couldn't, I think they went for sort of a softer language in the final report, and that those should be co-located within existing syringe exchange programs. And so where this stands now is that the FIFs have not been created as yet, and we are looking on the state level to have legislation that would allow for FIFs to be created not just in New York City but in New York State. There was legislation that was introduced last session. It didn't get anywhere, but this is sort of a case study that's kind of unfolding as we speak, because we're still working to make this vision a reality, but we're certainly farther along than we were a year and a half ago. Do you want to add anything to that, Adrian?
No, I think that does it. There's still some correspondence between our Deputy Mayor of Health and Human Services and the New York State Health Commissioner on whether this is something that the state can recommend serve as a research opportunity to model after our syringe exchange programs start many years ago. So our fingers are crossed.
Yeah.
Kim and Adrian, I just wanted to remind you both that we're running a little bit behind, and we wanted to give people the opportunity to get some questions in so that we could do a Q&A. Just wanted to.
Yes, I think we're all set. I mean, there's just one more slide, and I can do it in a sentence. Just that Kimberly and I wanted to emphasize that the work is ongoing. The collaborative efforts are ongoing. Just last month, the health department convened all of the HIV and STI policy advocates from across the city, so we could really brainstorm ways to achieve additional policy successes over the next couple of years as we head towards our ETE goal. So we are very excited to pursue some policy advocacy around sexual health education in schools, supportive housing, condoms as evidence, workforce opportunities, and we're now at a point where a lot of the HIV specific work has been accomplished. So we now can start implementing that and also start brainstorming other social determinants of health work that will affect New Yorkers living with HIV. Kimberly, I don't know if you wanted to add anything before questions and answers.
No, we could just turn it right over to the Q&A. Sorry. Thank you.
Thank you so much, Kimberly and Adrian, for an excellent presentation. Now is the time if any of our participants would like to send some messages over in the chat so that I could read them to our speakers, and they will happily answer any of the questions that you have. We'll definitely facilitate time for that. Okay. Kimberly and Adrian, I have a question. Working with or community-based organizations, and you mentioned coalition building, how were you able to achieve that, and how were you able to get buy-in from the community to actually go along and work with you on certain policies and projects to get you to work towards these goals of working together?
Well, it's certainly an ongoing and evolving process, and it's not easy. I don't ever want to suggest that coalition building, as I'm sure many folks on the call know firsthand, is easy or quick, and we don't always all get along, and we're not always linked arms and sharing the same ways. There are means to get to a goal, but I think we do what is shared is just this sort of common idea that we can end the epidemic as we know it here in New York State, and so it's just a slow, sometimes frustrating, I would even say, at times infuriating even process but we're kind of all committed to the same goal. The calls that we have every other week are just literally going through our agenda and our priorities and talking about sharing ideas about how to get to those. We do everything by consensus, and we are very fortunate that we have one community organization, Housing Works, which has the resources to staff our Ending the Epidemic 2020 coalition. So I think it is important to have like somebody who's organizing, like literally coordinating meetings and setting up calls and et cetera. But other than that, it's really consensus, community driven and led process. And we just, no matter how hard it gets, we kind of just stick to that, stick to it and see that our goals are reached.
And I would just add that factoring in government participation and building community trust of government, if you find yourself lucky enough to be in a place where your health departments and social services departments and mayors and elected officials sort of get it and sort of get why ending the epidemic strategy is important, then I think what's important is just to increase visibility, to show the community that government leadership cares and supports their efforts has proven incredibly effective and you know, first nature for us, really. And I think it's also about identifying champions that hold you know, an elected position. Is to identify a city council member or someone in your state senate or assembly who can really you know, serve as the face of the government entity who can move things forward, I think is also key.
Thank you for answering that. That's very critical information, and definitely appreciate the both of you chiming in on that. Which, if both of you could answer, you know, what would be an example of collaboration that you're most proud of where you are working?
Currently?
I know that I always say I don't play favorites, but if I had a favorite, the PrEP for adolescents policy change has been something I've been most excited to even be a part of. And I know Kimberly probably agrees and really led that effort on the community side. So that's my favorite.
Yeah, I would have to agree. That's been really one of my favorites. I think now, you know, we continue to work on ensuring that PrEP is accessible to everyone, not just adolescents, but I think that has been something that I've remained interested in. I think it started, you know, making sure that communities of color were reaching and accessing PrEP, and then for me it went to adolescents and now to women, and I think so PrEP has been one of the sort of themes through my particular involvement. Right now at Callan Lord, I'm working a lot on transgender health issues, and that's been a big thing. But I think I would echo Adrian's sentiment around PrEP for adolescents.
Thank you both. And I just wanted to, with that, say that that concludes the end of our webinar today. And just wanted to encourage everyone who participated today to submit their survey or complete the webinar survey for Ending the Epidemic. And also encourage you guys to follow us following this webinar by joining us on the after party today. As soon as this webinar is over, we will continue the conversation and expand our discussion with Anthony Fox, who works with the DC Health Department and is the Division Chief over Capacity Building, Housing, Community Partnerships over HOSTA. And we will conclude by also saying that we have our upcoming webinars. You don't want to miss next week, July 19th at 2 p.m. Will join us for the Nonprofits and Advocacy webinar, which will highlight learning about the do's and don'ts of advocacy as a nonprofit organization. Again, you don't want to miss that. The webinar after party following Nonprofits and Advocacy will be with special guest Samantha Saronic-Durcher, who currently serves as the Federal Policy Director of SECUS. And so you really want to join us and continue the conversation and join us for some meaningful and exciting conversation regarding nonprofits and advocacy and all of the important work that goes into that. Ladies and gentlemen, thank you very much for joining us. I want to thank Adrian Guzman and Kimberly Smith for being our speakers today. Have a wonderful day.
Thank you.
Thank you.
Thank you.